Remove the cap from the tube and replace with adapter. Attach adapter until tight. Then remove the cap from the adapter. Prime the tube by squeezing until medication appears inside the adapter. Attach a dosing syringe to the adapter until tight. Begin dosing by slowly pulling on the plunger until the medication reaches the prescribed level. If medication fill is incomplete, remove the syringe and reprime the tube. When the dose is complete, remove the syringe and place cap on the adapter. Attach disposable applicator tip to the syringe. Insert applicator into the anus until reaching the safety flange. Press on the plunger to apply the medication. Rotate the syringe slightly while removing to disperse medication. Remove applicator tip from syringe and discard. Wash syringe with warm water and store for future use. If you have trouble inserting the applicator all the way, or you experience any pain, try a different self-medication position or have someone help you apply the medication. A lubricant such as Aquaphor can be used to help with insertion. Make every day pain-free.